Hello, everyone. Happy Friday. Thank you so much for joining our webinar today. A healthcare sector analysis focused on nursing in Kentucky, presented by EMSI. I'd like to introduce you to our panelists today. We have Julie Marfell, Associate Professor at the University of Kentucky College of Nursing. Delanor Manson, Chief Executive Officer, Kentucky Nursing Association. Anna Brown, economist, Vice President of Higher Education Consulting with EMSI. David Mayham, Associate Vice President of Data Research and Advanced Analytics, CPE. And last but not least, Dr. Aaron Thompson, President of the Council on Postsecondary Education. Dr. Thompson is the president, as I just said, of the state's Higher Education Coordinating Board. Before taking the helm of CPE, Dr. Thompson served as interim president of Kentucky State University and as executive vice president, provost, and faculty member at Eastern Kentucky University. He has extensive leadership experience in the private and nonprofit sectors, including healthcare. He has served on the Baptist Health Board as board chair and as member of the governance and compensation committees. He also has served as board chair of Patty A. Clay Hospital in Richmond, Kentucky. Dr. Thompson received his doctoral degree in sociology from the University of Kentucky with an emphasis on organizational leadership. He earned a master's degree in sociology from the University of Kentucky and a bachelor's degree in political science from Eastern Kentucky University. Dr. Thompson, I'd like to hand it off to you to give us a few opening words.
Thank you, Carrie. Thank you, David, and panelists. It's great to be with you today. It's great to be a part of this conversation in more ways than one, as the person who's kind of responsible to lead higher education and work with some great people on our campuses, campus presidents, and other folks who care about higher education. It's key and crucial for us to know exactly not just where we've been in the past or where we're currently at, but what the future is going to look like. Today, obviously, we're going to talk a little bit about a key element of that for Kentucky, a way to not just provide what we surely need in Kentucky is good health care, but a way that we can build the economy that will be even a more active way of thinking about the future of our workforce. So this is, to me, a crucial conversation. This is the second report that has resulted from our partnership with EMSI, which is great to work with. And as you all know, EMSI is a labor market analytics firm with the Strata Education Network, which in this case surveyed Kentucky alumni about their perceptions of higher education experience. We're also looking at examining the workforce with EMSI in areas like engineering, in which you've heard something about already. This report really examines the trends in Kentucky healthcare sector. It's a topic that is not only of interest to our post-secondary folks, but also our governmental officials, as well as many of the healthcare sector people that are for profit as well as nonprofit, as I am with Baptist Healthcare. Today, we'll look at healthcare employment trends from 2009 to 2029. And before they go into it, and I'll let them do all the real work here, I just wanted to spend a little time just to talk about, if you followed anything around this COVID crisis, you know that there are many reasons to have this conversation right now. There were reasons before COVID. But now more than ever, there's reasons to think about how we build the capacity in this state of having healthcare truly on the forefront of what we're doing. I would be remiss if I didn't say that there's a lot of other items we want to correlate with this conversation, with these data. I mean, such as how we look at equity and inclusion and how we make sure that no one's left behind with good health care, as well as no one's left behind in being a part of the healthcare industry. So David, I want to thank you and the team for the work you've done. Just know that we're going to be partners with people like EMSI, Strata, and other folk all the time to make sure that we're providing the right kind of analytic direction we need to make good policy and to make sure we follow through with good process and procedures. So David, I'm going to turn it over to you, and I thank you for letting me be a part of this conversation.
Thank you, Dr. Thompson.
Thank you so much, Dr. Thompson. We're actually now going to turn it over to Anna Brown, Vice President of Higher Education and Consulting with EMSI.
Great, thank you. So to provide a little bit of background about EMSI, as Dr. Thompson mentioned, we are part of the Strata Education Network. We are a labor market data and software company located in Moscow, Idaho, and our data covers billions of data points, covering 99% of the workforce. This includes industries, occupations, programs, and more, and we collect this from dozens of sources. The sources include government sources, real-time job postings, and professional profiles. And through this presentation, you will be seeing a mix of data coming from each of these different sources. We're able to provide our data at a variety of geographic combinations, and our data is updated on a quarterly basis, which helps provide a more up-to-date view of what's going on within the economy. And with that, I will turn it over to David to talk about the presentation.
Good afternoon, everyone. David Mahan, Kentucky CPE Council on Post-Secondary Education. So you're going to see 7 topics that we're going to go through, and we have slides and summary items as major points and takeaway. The most important part of this webinar is to begin to get our Kentucky leaders in the healthcare industry to think about using this information as a tool. So there's 324 pages of this report, which is very comprehensive, but it is easy to navigate. And so it's full of information tables, so to address your very specific questions. Our research question is quite basic, and this is something that we have been really discussing and trying to understand for many years in Kentucky. So are we meeting the workforce demand in healthcare with the number of our trained graduates in the healthcare industry from Kentucky institutions? And so this question is not only just about volume, but it's also about, once we train a healthcare professional, are they staying in Kentucky? And what plays into that question is things like nursing wages in Kentucky, that third bullet there. And so one of the big benefits from the EMSI side is we're able to track out these graduates after graduation and really look deeper in terms of how we compare to other states. The other thing that we've been looking at is a program gap analysis, which gives us real recommendations for our academic programs in the state. So as you know, with any information, we have to localize it to make it actionable. And so we broke this down into 4 workforce planning regions, Central, East, South, and West, which is the typical breakout as we look at workforce development in Kentucky. But we did make one change. We added Kentuckiana so that we could break out the Louisville area and the Lexington area, since there are 2 largest metropolitan areas. And so let me just say, as we approach a study like this, we really want to be able to address the very detailed questions of, is the workforce adequate for these underserved areas, especially in Kentucky, in our rural communities and some of our urban metropolitan areas. So our occupational groups are pretty much what you would think we should focus on, everything from medical doctors to the nurses and clinical practitioners, but we also include, the dental health workers and the medical administrators and the athletic trainers and physical therapists. All play a vital role in the quality of the healthcare system. So today we're going to focus the webinar on direct care workers and nurses. And within this occupational cluster, if you will, we're going to look at the biggest job producers, the nurse practitioners, the registered nurses, the LPNs, and the CNAs, or nursing assistants.
Thank you so much, David. Anna?
All right, thank you. So before we start going into the healthcare jobs, one important perspective that we like to provide is let's look at jobs overall within Kentucky. So this isn't just healthcare, but it is all jobs in Kentucky. And what we see is that overall, that Kentucky's job growth is growing at a little bit of a slower pace compared to the US, with Kentucky jobs from 2009 to 2029 growing at 15%, and US jobs as a whole growing at 23%. When we look specifically at healthcare, we do see that jobs for healthcare within Kentucky are still behind that of the US in terms of growth. However, they are growing at a faster rate compared to when we look at all jobs. Also noteworthy is that nurses, which is what we are really going to be focusing in on in this presentation, account for nearly 47% of healthcare jobs in Kentucky, compared to around 30% of healthcare jobs in the US. So what this means is that nursing or healthcare jobs are more concentrated in Kentucky compared to across. I will continue talking through then without the slide. So, what we did was we took a look at all of those occupational groups that David mentioned, and we broke down which of them are kind of driving the healthcare growth within Kentucky. And what we see is that direct care and nurses represent the largest group. Between 2009 and 2019, jobs for direct care workers and nurses increased by 10%, and they are projected to continue to grow until 2029. The second largest group of healthcare jobs within Kentucky are clinical practitioners, and these are followed by medical doctors and mental and social health workers. All other healthcare workers are represented on the slide by the top dark gray section. All right. I'll just pause here just to allow you all to be able to take a look at the slide. Overall, all healthcare occupation groups have experienced growth in the past 10 years and are projected to continue to grow over the next decade. And here on the next slide is where we go into a little bit more detail around Kentucky's jobs for nurses. We see that RNs and CNAs are by far the largest occupations, together accounting for around 70% of the nursing jobs. RNs grew by 20% between 2009 and 2019, and they are projected to experience 11% growth from over the next decade. And they will be seeing the most overall growth of the nursing occupations. We also looked at nurse practitioners, and while they are the smallest of the nursing occupations, they are projected to grow by over 23% over the next decade. All right. Looks like we have the screen sharing coming back online here.
Yes, we are back.
Great. So, Carrie, if you don't mind going to, we'll pause on the Kentucky's jobs for nurses, which I just talked through, but we will pause and I can reiterate really quick on the next slide. Perfect, thank you. So here, as I mentioned, the RNs is the top line there, and they are projected to grow by one more slide down. Perfect. And they are projected to grow by the most. And then we have CNAs, LPNs, and nurse practitioners also represented within the nursing group. On the next slide for doctors, we are focusing specifically on nursing in this webinar, but we also wanted to include data specific to doctors since a lot of questions, especially in light of COVID, have come up around doctors. So as we see, physicians represent the largest occupation, and they are projected to experience strong growth through 2029. Note that physicians cover a range of specialties, such as family practitioners, pediatricians, surgeons, and more. And similar to nurse practitioners on the previous slide, physician assistants account for the smallest group. However, they are projected to grow by 28% over the next decade. This slide, it looks a little busy, but what it does is it covers all healthcare occupations, not just nursing, and it helps show which of the healthcare occupations have strong wages and strong growth, as represented by the axes. The size of the bubble represents the number of annual job openings for the occupation, and then the bubbles in blue are the ones that we'll focus on today. As seen, among Kentucky's largest healthcare occupations, home health aides are projected to grow the fastest by 46% over the next decade. However, they also see low wages at around $23,000 per year. Physicians and surgeons are paid the most and are projected to experience decent growth, although there are not quite as many jobs as other occupations. And then when we look at RNs, not only are they paid well at over $55,000 per year, but there are a lot of job openings for the occupations. So this information, combined with the previous slides, is helpful for homing in on areas of opportunity within healthcare, which we will continue to dive in as we go. And lastly, before we turn to looking at some migration and program information, we'll look at the demographics of Kentucky's nurses. And this is based on nurses currently employed in Kentucky. We see that nurses are typically white females with a slightly higher representation of people of color within nursing compared to all occupations, and fairly similar representation when looking across all healthcare occupations. We also see that more nurses are females, around 91% when compared to all healthcare occupations, around 80%, and especially when compared to all Kentuckians, where around 51% of Kentuckians are female. Interesting and also good news is that nurses are not in danger of graying out, or in other words, retiring soon. We see an even distribution of the nursing workforce between 25 and 64 years old. And with that, I will turn it back over to David.
Much, Anna, and so sorry about the technology mishap.
That is okay. It happens quite a bit. Thank you, Carrie.
So the migration analysis is one of the important elements of this study. We have access to the EMSI information. They have 120 million employee profiles that we can do analytics on it, and it allows us to track our alums after completion to see how many are still working in the state of Kentucky. And you can see the 56% in comparison to 49% is the national average of alums staying in their home states. So that looks quite positive. I can tell you that the most important comparison is how we do with our bordering states. And so in some states, such as Illinois and Ohio, we're a little bit below their average. They're in the low 60s. But for the Tennessees, the Missouris, we're right there at 55, 56%. And so we think that's a positive takeaway, but certainly something to keep a close eye on. A big factor in whether a nurse stays in Kentucky, especially considering many of our training programs are right on the border with other states, is the wage. And so it's quite easy for our nurses or any of our healthcare providers to go across a state border for employment if the wage opportunity is better. If you track the registered nurses, which is the first row there, straight across from left to right, you get a sense for how our median wages in 2019 compare with the other states that we picked as benchmark states. That 5 there represents that we're 5th in the stack rank, which you would take away an idea that this is problematic, although we're only $2,000 or $3,000 away from those bordering states. And so we may be a little more competitive than just this slide would indicate. So we also drop in the 2009 comparison so that you can see how this has changed over a decade. And the first takeaway here is that, the nursing median wage has gone up from $55,000 per year to $61,000, which is certainly healthy, but we haven't moved, in that stack rank order. And so it's been pretty consistent. We're slightly ahead of the same states that we were ahead of before and behind the others. Texas is a bit of an outlier, so we don't look at that as much as problematic. The other interesting occupation in this in the healthcare sector in terms of wages is the pharmacists, and so we're third in the stack rank here in 2009, and we move up to number 2 in 2019, and you can see about a $16,000 per year increase for this occupation. So we're very strong in terms of keeping our pharmacists employed, and that also may be just on simple counts that our pharmacists are in high demand for the number of job openings there are in the state of Kentucky. So this is our first COVID-19 before and after slide, and there's much information in the report about COVID-19 and the effect. And so we hope that participants in this webinar and others can get good value in assessing the impact of this new environment. You see in the blue horizontal bar, this is the monthly job postings during the quarantine times, during those quarantine months, and then the gray bars are those months that were the average over the past year. And so you can see a real sharp decrease in the number of registered nursing job postings, about 29%. But you see an increase in the LPN numbers, which is interesting considering the LPN numbers have been very flat over the past decade. So this is our summary, our summative slide, if you will, to answer our research question. So as we look at annual number of graduates, the count of annual number of graduates from Kentucky institutions that hold a baccalaureate degree or higher, you see the blue line going left to right over 2009 to 2019, 18-19, and then we project that out through 2029. And so that blue line tells us the yearly production, if you will, in terms of this number of graduates. And so we go from about 4,000 there in 9-10. By 18-19, we're up to 6,000. That's about a 50% growth. And if we continue on this trajectory, we ultimately will meet the job demand of healthcare jobs in the state of Kentucky. I say if, because certainly this is contingent upon enrollment. And now we have very uncertain times with enrollment with the COVID-19 environment. So as you would expect, the baccalaureate enrollment is a 4-year prior look. And so it's a very positive growth number 4 years ago. And so we're going to see continued growth in the number of graduates, but that may flatten as we go forward, depending on enrollment and what the workforce looks like as we begin to recover from the COVID-19 environment.
Anna?
Great. So this slide is taking a deeper look at the supply and demand for registered nursing. And here, what we are focusing on is the registered nursing program, and then we are looking at it across the region and across different award levels. So what we did was we looked at all institutions offering the program by region and award levels. We then looked at the demand for the program in terms of annual job openings for occupations the programs train for. Registered nurse was the primary occupation related to the program, although we did include a few other smaller nursing occupations where relevant. And what you'll see is that there are 2 numbers that are provided for each region. One is for certificate and associate degrees combined, and we refer to this as Cert Plus, and that's the top number. And we also look at bachelor's degrees, master's degrees, and doctoral degrees combined, referred to as Batch Plus, and that's the bottom number. A gap means that there is more demand or job openings for the program than there is supply or program completers. And then a surplus means the opposite, where there is more supply of completers or graduates coming out of the program than there is demand for the job openings. And what we see, and this is really where getting into the different local regions is important, because we see that there is differentiation across the state. For example, the South is doing a great job of meeting demand. Even though there are small surpluses, we feel that they are within labor market fluctuations. We see there is more need for a bachelor's degree and above nursing in the East and West WPRs than is currently being supplied. But there are more nurses across all award levels being provided in Central or Lexington area. However, this may be because of the concentration of institutions in the region, and completers may then be going to the other areas of the state. When we look across Kentucky as a whole, we see a surplus of registered nurse completers across all award levels. Note that the regional numbers do not necessarily add to the state numbers, given that there are some online institutions that are only included in the state analysis. There's particularly a large gap for bachelor's degree and above registered nurses. And we'll go into more detail on what is driving these figures in the next slides. So this slide provides a little bit more detail on which sector, and by sector we mean whether it's KCTCS, whether it's the private institutions, the state universities, or licensed out-of-state schools. And so we're able to see which sector is providing the most nursing graduates by award level, and then we'll also visualize this a little bit better on the next slide. But in general, we see that at the certificate level, there is low demand, low supply, with registered nursing programs only offered by licensed out-of-state schools. And then around half of the state's registered nursing program graduates are awarded an associate degree by a KCTCS institution. And overall, we see moderate demand with high supply. At the bachelor's degree level, 7 out of 10 RN program completers are, they receive their degree from a state university, and we in general see high demand, high supply. And then at the master's degree level, the licensed out-of-state schools are really driving the number of program graduates for the RN program. And here we can take a look at it on the next slide here. So we have the gray bar at the on the top for each award level represents demand or annual job openings. And we see that the most demand is at the bachelor's degree level, and then followed by associate degree and then master's degree. And as would be expected, there's little demand for RNs at the certificate and master's degree levels. We see that there are a lot of master's degree completions, especially from out-of-state licensed providers such as South University. And one thing to note is that these may not be full credentials. They may be for nurses who are already employed and gaining additional credentials for wage increase. And so this would be an area to perhaps further explore. And there are also quite a few associate degree completers across the sectors. It's not just KCTCS who is providing associate degree RN graduates. And I will turn it back over to David to summarize.
And I think it's an important, let's go back just one more slide, Carrie, just to highlight Anna's note. I think it's really important as we look at this and see this surplus in master's MSN, nurses, we can think about what Anna said in terms of, these could be employed nurses that are going back for additional credentialing, and maybe they got a raise from that work or a new job opportunity, but it wasn't necessarily another job posting by the organization that they were employed by. And so it looks like a huge surplus, but I think there is a sense that these folks are getting additional credentialing to benefit themselves and their families. And so I have two slides that we call program demand gap analysis, which basically is when we're mapping these occupations over to the academic programs, and then we're looking by region to say what academic programs could be expanded in terms of numbers, which academic programs are about right in terms of the volume of graduates, and which ones could even be scaled back because the workforce doesn't demand the number of graduates that are coming out. And so you can go into the report and see a very detailed profile, not only by nursing, but all the occupations, by region. And we think that should be very helpful for our campuses as we talk about their future programming. The short summary is that, as Anna said, in the east and the west side of the state, and certainly in the Louisville area, there continues to be this drive for additional baccalaureate level registered nurses, and that will continue. And the east and the south and the central are pretty balanced in terms of the number of graduates versus the job demand. So overall, we think this is a pretty positive slide for the state in general. And we can also note that there are, many occupations in healthcare that we're not going to be able to talk about today, but we'll continue to see high demand at the certificate or associate level, such as pharmacy technician, medical records, medical managers, in those areas of respiratory therapy and clinical lab science and radiation therapy will continue to be very positive and in high demand going forward. So our last slide breaks out quadrants of high demand by demand and supply level in terms of academic programs and what we should be thinking about. And so I want to highlight the top left-hand corner, which is nurse education at the baccalaureate level or higher. And we're very fortunate to have two nurse leaders as on our panel today, and we're going to turn it over to them for a discussion of this data and what they're seeing day to day. But, suffice it to say, as we're looking at nurse education being low supply and high demand, this critical role of being an educator and a faculty member as nurses are being trained, it's harder and harder to get nurses to come back and provide that role because they have so many other roles, right? And many of them are in doing direct work with patient care. And so this is a good segue into our conversation with our panel. So I'll take it back to Carrie and we can begin the discussion.
Thank you so much, David. Yes, before I turn it over to our panelists, I would like to give a short introduction on them. Today we have Dr. Julie Marfeld with us. She's an associate professor at the University of Kentucky College of Nursing in the Executive Clinical Leadership track. Julie is a nursing leader, educator, and family nurse practitioner. She received her diploma in nursing from Barnes Hospital School of Nursing and her BSN and ND DNP at Rush University. She has served on state and national boards of directors for nursing organizations and is currently the vice president for Kentucky Nurses Action Coalition and leads the Nursing Workforce Committee. And then we also have Delano Mason, MA, BSN, RN, Chief Executive Officer, Kentucky Nurses Association, Kentucky Nurses Foundation, Kentucky Nurses Action Coalition nurse, healthcare executive, and thought leader. With degrees in nursing and healthcare management, Delano Mason is a visionary leader whose career has focused on innovative medical initiatives in both patient care and complex administrative settings. Committed to furthering the nursing profession via education, advocacy, research, and support, Delano currently serves as the Chief Executive Officer for the Kentucky Nurses Association, KNA. Prior to joining the KNA, she was Associate Vice President of Research and Design at Hospice Health. She also served as Deputy Secretary for the Kentucky Cabinet for Healthcare Services and in various leadership roles within hospitals and healthcare organizations nationwide. With 27 years of service, Delano achieved the rank of captain in the U.S. Navy. During her military career, she applied her nursing education to various positions throughout the country, as well as in Japan, Great Britain, Germany, Italy, and Puerto Rico. Delano has a Master of Arts in Healthcare Administration from Webster University and a Bachelor of Science in Nursing from the University of Kentucky College of Nursing. And at this point, I would like to turn it over to these esteemed panelists and hear their thoughts on this study.
You want to go first, Eleanor, or do you want me?
I always like being your wing person. You go first, Julie.
Thank you, Eleanor. We do make a pretty good team. Well, first of all, thank you very, very much for inviting us. I and Eleanor, the two of us had the opportunity to do an interview with WEKU with Stu Johnson about this report and got the call that you guys were interested in talking to us. So we appreciate it because we know how important nursing is, especially right now. It's been highlighted. It's always been important, but with COVID, the nurses are front and center. They're on the front lines every day. And I mean, I had my hood and I've done it today already here in my clinic. So thank you very much for recognizing us as a really important part of healthcare, because we are. One of the things that strikes me, a couple things about the numbers, is the numbers that are predicted for Eastern Kentucky. I'm not sure we really have a surplus anywhere, to be honest with you, when we look at those numbers, especially when you think about some of the universities and in advanced practice who produce quite a few graduates who graduate from a program here in Kentucky, but do not live in Kentucky, never have lived in Kentucky. They're actually it's a distance program. And when you say we have too many midwives in Kentucky, that's because of Frontier Nursing University, and those midwives do not stay here because the practice laws are not good for them, and we're trying to change that. But that's why Frontier produces the largest number of nurse midwifery students and graduates in the country. So you got that sitting down there, which I think skews the data a little bit, especially on the midwives. But when you look at the state, out of 120 counties, we only have 20 that are not considered medically underserved. So that includes the physicians, the advanced practice nurses, which are the nurse midwives, the nurse practitioners, nurse anesthetists, and clinical nurse specialists, and also the registered nurses as well. So I think that it depends on where you live, whether or not there's a surplus, even though you have it drawn out a little bit differently. Because I think that we will stay and meet the demand. People are only getting sicker, they're living longer. You need a nurse. You need a nurse for a lot of different things, but you definitely need a nurse to be a part of your healthcare team. And I think as we continue to change healthcare and specifically the way we deliver healthcare, nursing is going to have even more of a vital role, because it won't just be at the hospital, at the clinic. It's going to be more and more in the community. I've said that for years, and I think it's coming. I really do, especially now with COVID. The public health nurses, there are not a lot of them, and we need them so much right now. It's unbelievable when I think about it. It's one of those things that kind of got moved over to the side, and it became home health and not really public health. And there's a huge need for that. These are the people that be out knocking on the doors right now, doing the contract tracing, going in, making sure everything's situated in homes and schools, and we don't have enough school nurses. I can go on, but I won't. But I think it's real important to think about it besides just the role of in the hospital. And the fact that we are underserved. We're underserved everywhere in the state. And again, if you look at that eastern half of the state and eastern and southeastern, when you lay a map over that looks at poverty, you run the same line. It's the same. And I drove down in the mountains for years, and I can tell you just about when you hit it, just based on my route down the interstate. I could tell you exactly when the map didn't surprise me, because I lived it down there. The other piece of it is those people do not live as long. That's the other piece. I keep saving the Herald Leader because it'll show, it'll give you those statistics about southeastern Kentucky. And I like to lay them over on the slides to really demonstrate to the students that indeed, this is a problem. It's here. The other place that I don't think it's totally accurate, and you're going by job postings, and please don't think I'm criticizing your report at all. I think it's absolutely wonderful to have this data, just absolutely wonderful. But I think there's a lot of hidden pieces to it, is that in the urban areas, you also have pockets of underserved, that there's not enough healthcare providers in those areas as well, in Louisville, in Lexington, I would say even probably down in Bowling Green in that area now as well too, and up around Cincinnati. There are pockets of places there that do not have enough healthcare. It's not well represented sometimes, depending on how you look at the numbers, but there's a need there as well too. So nurse educators, we need them. We need more nurses. We need more nurse educators. I'm not going anyplace for a while. I don't think many of my colleagues are either, but we are graying the nurse educators. There's no doubt. So what would get them more nurses interested in nursing education is you would pay us more. We are not paid as well as the nurses that are working in the hospitals, the nurses that are working in different places. We need better salaries. And don't get me wrong, the universities work towards that. It's a national thing. It's not just in Kentucky. It's just nurse educators are not paid as well. We never have been. I don't know why, because I think my job is just as important, educating the future nurses as it is taking care of patients. And again, I don't mean to be one against the other. I think they're equally as important. And I know I feel responsible for my patients when I'm in clinic, and I definitely feel responsible for my nurses, that I get them off on the right first, those nursing students. So I'll stop there for now and let Delanor talk a little bit.
Well, Julie, you said all the things I wanted to say.
I know you've got more.
Actually, I also want to say thank you for including us, because nurses play an integral role in healthcare. We're not always seen that way, but COVID has brought us front and center. And with our Kentucky Nurses Action Coalition focusing on workforce development in collaboration with the Robert Wood Johnson Foundation and AARP, looking at the future of nursing. The data that you presented is very interesting to us as well. Some of the things that Julie has talked about are basically the things that you asked us to talk about, which is how is this data, how does it really reflect the nurses on the ground, the nurses in the forefront, and the everyday life of the nurses. And so in this year of the nurse, which 2020 is the year of the nurse, and we had no idea that a pandemic would lift us up for the year of the nurse as it has, but it certainly has. Nurses are data driven. And so a lot of the data that Julie provided for you are data that we look at for the Kentucky Nurses Action Coalition on a regular basis. Julie's talking about her maps and laying them over with the poverty. She just recently did a presentation to the Kentucky Nurses Action Coalition and the Kentucky Nurses Association on that data and what it projects. A couple of things about your report, and David, you mentioned this, is that about other healthcare workers and providers in the system, like respiratory therapists and social workers and mental health workers. These are jobs that nurses used to do. And so now within nursing, we are collaborating with these professionals to make sure that patients' families have access to care and that they're getting the care that they absolutely need. When Julie talked about how to move experienced qualified nurses from different levels of care into education, that is one of the most important things that I have found, is that we have some incredible faculty throughout our universities. However, we don't pay them. And so what happens is that they are faculty, but they do other things so that they can have a quality of life. And so in other professions, when you have a doctor of nursing, a doctor of anything, they get paid much better. So if we really want those qualified nurses to move into faculty positions so that they can prepare more nurses to do more expanded roles in healthcare and outside of healthcare, then we have to pay them. A couple of the things that I thought about was nurses, based on their education, are qualified to do a lot of different things outside of healthcare. For me, for instance, in my career, I've had an opportunity not only to be a naval officer, but also to be a hospital CEO, to be a consultant for an engineering company, to do things outside the traditional roles of being a nurse at the bedside. And so I think that it would be a good idea to continue to educate nurses and see how they might be able to impact healthcare in other ways other than being in acute care or even in outpatient care. There are just a lot of different roles for them to take.
Thank you so much. I'm going to take this chance to remind everyone who's watching on YouTube, you can ask questions through the YouTube chat. We do have some questions for our panelists, but again, please feel free to ask questions as we continue to talk with them. Miss Julie, I'll start with a question for you, if that's all right. Well, Dr. Markfield, I should say. You began your nursing career with a diploma level credential, then progressed to a BSN and a doctorate nurse's practice. What do you tell prospective nursing students in terms of training?
Well, that's a good question. I say that they should not stop for a couple of reasons until they get to where they need to be with their education. That diploma tells you how old I am, basically, because that's an old thing. And I went to the school that I worked as a nursing assistant when I was in high school. I became, we weren't certified back then. I just took nurses aid training and worked at our local hospital a couple of evenings a week. And that's really when I decided I wanted to be a nurse, to be honest with you. I wasn't sure of it before. I think it was just a way for me to be employed in high school. And I think my parents, frankly, wanted me to have a job and not be doing other things in the evening, which was probably a good idea. But it really did. I found nursing that way. It was something that I enjoyed. And I won't say that it's easy, but it came easy to me. I felt like it was something I could do. As a high school student, I'm like, I could do this. I think I can do this. And I said I'd go to the place that all the nurses that I worked with, which there were many of them at that little rural hospital, I wanted to go where they went, and they had all gone to Barnes in St. Louis. Most of them. Some of them gone to Springfield, and because I'm from Illinois. But I decided I wanted to go there, and I got my diploma. I worked for probably 5-6 years, and I moved to Chicago. And when I moved to Chicago, they paid you more if you had a bachelor's degree. Well, that was a big incentive for me to go back to school. I wanted to go back to school anyway, because the other thing was that this group of women and men that I worked with in the MICU were just phenomenal. And I wanted to be like them. And most of those people were back in school because Rush University was right there, and they had tuition reimbursement as well. So that's initially why I went back to school, was to get that degree. And so I could get a little more money. The other thing is that I realized that I could get people out of the intensive care unit, depending on what they came in with. Well, I always said one way or another. They didn't stay there forever, but I didn't ever want them to be there again. I didn't want to see as many patients as we did in the unit. So I went back to school to be a family nurse practitioner, because I thought I could make a difference that way by keeping people healthy and helping them manage their medications and really to understand what was going on with them so they could get better. And I think I've done that. And after I finished my doctorate, they asked me to join the faculty. And I said yes. And part of that, I'll be honest with you, was salary as well too, because Rush again paid for my degree. So I had a doctorate at that point in time, and I was being paid better at Rush because I had a doctorate than I were in many other places that had offered, I looked at as far as positions. So that again was an incentive to stay there. But I soon realized that if I was really going to make a difference in people's lives and in changing how healthcare works and how people stay out of intensive care, I couldn't do it by myself. I needed to be an educator to be able to bring other people along with me. And that's why I stayed in education. I've been in education ever since. I've continued to practice because I love it. That's where I'm at today is my clinic. I do this one day a week, and it's one of the best days of the week always. So, I've never been too far from it. I've also been an administrator in different positions. I was an administrator over a set of clinics before. I've, been a dean, an associate dean. I've done administrative positions, and I'm trained to think like a nurse, and nurses can do this, especially if you go back to school and keep going. You start to learn that whole process. We're taught that scientific process on how to think, and we continue to do it no matter what the setting, whether we're taking care of patients or we're taking care of a corporation or we're taking care of our students. So that's how I got back to school. And I probably told you more than you needed to know there, but.
No, thank you for
Did I
sharing.
answer the question?
Yeah, thank you. I have a question for you, Ms. Delano Manson. And Dr. Marfell, please feel free to engage in this one as well, because I know COVID is on everyone's mind. We can't turn on the TV, we can't open our emails without COVID. So how is COVID-19 impacting the role of nursing in healthcare? Is it increasing the amount of interest in nursing as a career? Is it a safe occupation? How has COVID impacted you and nursing?
KNA, we get a lot of phone calls from nurses who are afraid, but they know they have the skill and the knowledge, and they care, and they go to work. And they're concerned about their families, but they go home, and they get up the next day and they do the same thing. So one of the things that we've done at KNA is we developed a program. It's a mental health support program. It's called Kentucky Nurses Helping Nurses. And we've been doing videos, and we have resources on our website. We have 120 nurses around the state who volunteer to be peer support. But we have not had as many people to engage with our program as we'd like to. The American Nurses Association also has a mental health supports program, and they too have not had as many nurses as they thought they would have. So in talking with nurses to find out why are they not engaging in the mental health program when it's obvious that they are fatigued, they are tired, they're scared, because they say so. They tell us when they get home, they're so tired, they don't want to look at a computer. They just want to rest. They want to take a shower, take off all of those clothes that they had on at work, and have a cocoon of safety and goodness. And so what we are anticipating is that people are going to need these services ongoing. It's going to be similar to PTSD in that people may not be using those services now, but long after COVID is over, those services are still going to be needed. But I think that one of the things that drives nurses to go to work every day, to give their part, to do what is necessary, is that they want to be heroes, they want to be sheroes, they want to be people who are getting it done. Julie, did you have anything you wanted to add to that?
No, I don't think so, Delano. You've done, KNA has just done such a wonderful job with the Nurses Helping Nurses, and the education that KNA has provided. Many people, many organizations have provided lots and lots of information about COVID. KNA has done a stellar job of it. Our president, Ruth Carrico, was actually an infectious control disease nurse, Dr. Carrico, who has a PhD and a DNP. She's a doctor, let me tell you. She's, every time I talk to her, she's like, well, I'm up at 4 o'clock, and then I work all day till 10 o'clock. I get an email from her from 10 o'clock, because I mean, what a time to be an infectious control nurse in the midst of a pandemic. So, there's lots of people that are contributing to this. And I think that people see people doing this work, and many times they think, I think I can do that. And then I've asked many students over the years, why did you become a nurse? It's kind of a standard question. Or why do you want to become a nurse? Probably is the better frame for admissions. Time after time, they tell me it's because of a nurse that has taken care of them, that's taken care of one of their family, a friend, and they so touched their lives that that's what they decided to do. And I think you're going to see a lot of that with COVID. I do think everybody's tired. I do think there's going to be some PTSD. But I think this is also an opportunity for us to really come out and say, this is what we do, this is who we are, and we need nurses. So come join us, because it's a great profession.
Thank you so much. And the Nurses Helping Nurses sounds like a phenomenal program that KNA has started. How wonderful. We actually do have a YouTube question. Can the projected number of healthcare workers in areas outside of nursing be shared for analysis? As the Dean of Allied Health at JCTC, I'm very interested in the latest projections. This is Kara Schotter who asked that question. Thank you, Kara.
So I will jump in and initially answer it, and then David, if you would like to also jump in, then please do. So as David mentioned, today we are focusing more on a little bit around the healthcare jobs in general, but then focusing in specifically on the nursing. But there is a 300+ page report that has details across all of the healthcare programs and occupations, and that is something that we can definitely share with you afterward and be able to free to dig in. And then if you have any additional questions, then please feel free to reach out. I feel like this is a really helpful conversation right now since we're focusing more on the data side of it, and then having Dr. Marfel and Delanor, talking more about the day-to-day part of nursing. And so I feel like that's going to especially continue as this report is taking the data and the analysis, but taking it more down to what you all are feeling on the day-to-day.
I appreciate the data. It's great to see it.
And that's what nurses do. We love data. And the idea that we might be able to partner with you all to help us collect and slice and dice data just kind of makes us giddy.
Love it.
Yeah. And I think it's fair to say we will know that the report is being used as intended when we get questions like that and we see leadership on campus and leadership with hospitals and within the industry using it for evaluation of programs and resources. And so we're very thankful for that question, and that's the very intent of it. So the report is on our website, and then we can follow up and walk you through any of the details as needed. So please reach out to us.
Thank you. We're getting close to the end, but if you feel like you'll have time to answer one more question, I'm always happy to ask you one more.
Sounds great.
Great. Well, since I'm in control of the questions, I'm picking one that really is interesting to me. As someone who grew up in a rural area, I really am curious, do nurse and physician shortages in Kentucky's rural communities impact the quality of patient care? Do you feel like these shortages are being addressed?
Well, this is definitely a Julie and a Delanor. That's a perfect question for the two of us. We know that because we have nurse practitioners in many areas, it increases access to care. And if we didn't have those nurse practitioners, those patients and families would not have access to care. We also know that there are issues with access to care and prescriptions that we as an association are working on with our legislature, so that nurse practitioners can practice to the highest level of their education and scope of practice. Julie, you can do the quality piece. I'm going to let you have it.
Let me have it, yes, and I can. Yeah. Well, I would say that we provide quality care. There's just not enough of it. I mean, if you look at our outcomes, they're great. They really are. Nurse practitioners, we have outcomes that match physicians. And overall, I was looking at some data last night, nurse practitioners are in rural areas. Typically, they will go to rural areas when they're done. A lot of them come from rural areas. The article that I was looking at last night was from 2017. And it really supports what I say is that if you can educate someone in their community and keep them in their community. So if you've got a nurse who wants to go back and be a nurse practitioner, if you can support them, financial support and time away from work are the two things that they report that they need the most, they'll stay. Most of those people are going to stay in that community because that's home. So if you can do that for those folks, and even if you want to create your own nurses in that way, you can do that as well, and they will come back. But they need help financially and they need help with time. It's a lot to go back to school and do an advanced degree. And actually what's happening now is that our push is to have all nurse practitioners be doctorally prepared with a doctor of nursing science. I mean, that's where we're headed. We keep laying down a date and we keep working towards it. And there's a lot of master's programs out there. So it's difficult for everybody to transition. But that's where we would like to be, is with that doctor of nursing practice. So not only do they take great care of their patients, but they do a lot of quality work as well too, so they can analyze their practices at even a deeper level than they do with the master's degree. So they just continue to improve. But our outcomes as NPs are great. I mean, they really are. They're either at, or sometimes depending on what it is, the same as our physician colleagues.
I would just like to add one thing to that, Julie, and that is what the nurse practitioner takes to the practice and the access for the patient is that nursing knowledge, that nursing skill. And that is what we're saying that we offer to any physician, any board or commission that we have an opportunity to sit on, that physicians don't get that training. They don't have that education. And that's what gives us a little bit more to work with. in terms of the quality of care.
I would agree. And I'll tell you, I've been blessed. I have worked with great physicians as collaborators my entire career. And there's nothing better than a good team, you know, that guarantees you're going to have the best patient care if you got a good team around you. So
What I say about nurse practitioners, again, what they bring to the table is that they're nurses first.
oh yeah.
Well, thank y'all so much for your insight. I'm going to share my screen again really quickly as we wrap up in case anyone on YouTube or who watches this after we've uploaded it to YouTube has questions. We have a slide with some information on how to get back in contact with Anna and David. And I'm going to lead off with David and Anna to see if they have any closing remarks before we end this very informative webinar.
Well, I'd like to thank everyone, Anna and our panel, Delano and Julie, really powerful words and really great insight from the front lines, if you will. And so we really appreciate the time and the effort. And again, we hope that this research will be a tool to inform and our budgeting efforts and our planning efforts. And so we need everyone's help to help disseminate that report into the right people's hands. And we're happy to follow up from the data side and really flesh out any of the numbers that you guys are working on. So again, thank you to the panel and to EMSI and the rest of the CPE.
And I would like to echo the thank you. This has been a really fun project for us to work on. And so thank you, CPE, for the opportunity to partner with you all. And this has also been a great panel to be a part of, and especially hearing the frontline perspective as well. So again, I also welcome any questions that anyone has as you dig into the report. We are happy to help out with providing some clarity around them or digging into some of the more specifics around it. So please don't hesitate to reach out. And thank you again.
Thank you again to everyone.
I just wanted to say to David, thank you again for inviting us. Invite us again, we'll come.
Yes.
Thank you again to our wonderful panelists and to everyone who joined in today on YouTube.